Hi there, welcome. I'm Cassidy and I've been a Pilates instructor for 20 years, fitness for 30, and block therapy instructor for going on 4 years now. And I want to share with you a way that you can use some yoga blocks to support your blocking practice to make it more comfortable. That way you can relax. There is an opportunity to still gain some strength and core strengthening and arm strengthening. However, you at some point may reach fatigue, and if you continue to practice while you're over fatigued and you just want to get her done, what I found is that I can be sore in the wrong places the following day. So let me show you how this works. So I'm going to show you a few positions. So for example, the block position under the belly. Now, I like to use yoga blocks because they maintain their loft, unlike pillows and cushions. So you're often reminded to make yourself comfortable in your blocking positions, but I don't find the pillows and cushions, meet your expectations. So these are going to be much more resilient to your body weight and pressure. Now, if I were to get on my belly, but it was feeling a little too intense, I could redistribute some of that body weight over a larger surface space. And so by putting another block under my chest, it sort of softens that pressure right into the gut. A folded blanket or towel would work here because I'm looking for very little, but that might be a good example of how you could make the belly position a little bit softer, unless you wanted to work on a softer surface. On a bed, can be difficult because you're having to hold your face back out of the mattress and things, so I don't find that as comfortable. This to me is a little more effective. Okay, then if we go ahead and go, one of the other tricky spaces when I first started my blocking practice was the sternum position or the chest position. So if I could fit the block in between the breasts here, right on that large chest bone or sternum muscle, sometimes coming over, I'm feeling quite inverted, especially I'm not particularly tall, but for someone who is particularly tall, they are looking really inverted to try and get their body down to the floor. So I just raise the floor. So this makes it, especially if you had, say, acid reflux or something, or maybe even a blood pressure issue that you didn't like that inversion position, this allows me to be more level with my body. Reminder that if you're feeling like this is like a lot of pressure, these knees are probably too far back. So I'm actually in a decent straddle on my block, and then I can do all the normal things that I might have done without the block underneath. This same strategy works when I want to do the collarbone position. So, and I do want to warn you, just be sure that when you're here, you're not trying to make contact with this collarbone. This is, the joint is actually over here on this notch space. So my cue for my clients is below the breastbone, or sorry, rather below the collarbone, but above the breast tissue. So we're in this soft gap space, and I can just kneel over top of the block. That's going to help me control my pressure and not, again, avoid that inversion. Now I have a couple of clients who are post breast cancer surgeries, mastectomy, and they are feeling a lot of tightness or pain in the chest tissue after post-surgery, and they find this to be enough. Okay, I don't need to leave my body weight on top of that. Just some pressure here is going to be enough to create some intensity and hopefully some releasing for them. Another one to show you. Let's go into the shoulder position. I find that that one a little tricky. If I lay that block sideways, get my arm postured and all the rest, and then lay down on it, all I feel is this edge, like digging right into my side of my arm. So I get very localized pressure. But what I want is this muscular head of the deltoid. So I've got this thin little cushion. It's from a Pilates piece of equipment. You could get these at the dollar store during gardening season. It's your little colorful kneeling pad. So it's just about a 1 inch of foam. And I just create a little bit of a hill. And then when I lay down on it, I'm gonna get a lot more surface contact versus just hitting that edge. If you wedge this too steep, it doesn't really work. So you just need to get the edge on there. Even in my classes, like by Zoom, I'll say if you don't have that thin foam, a thin paperback novel would work. And then because I'm going to be sideline for 3 minutes or more, so I'll get that postured arm, lower the top of my arm on the block. But because I'm going to be here for 3 minutes, having had some neck injuries when I first started blocking, I'm better now, but I couldn't endure this side head hanging position for the full 3 minutes without getting a lot of fatigue in this top side of the neck. And in my experience, if I just endure it and suffer for the whole 3 minutes, the next day I ended up with like terrible headaches. So it's fine to work without the cushions for as long as you can, so that you do gain that strengthening, conditioning, endurance happening in your muscles. But when you reach that point of fatigue, creating some way of supporting yourself so that you could stay and continue with the blocking practice, but much more comfortably without that over fatigue happening, then I'm feeling like I can progress much more comfortably through the practice.